You get dressed, sit on that stupid piece of paper on the exam table in that flimsy paper gown, and you feel small, insignificant, like you have to ask permission to get your own health back. Permission. Permission to make changes to your diet. You know you're going to be judged, right? And then your idea is going to be dismissed. You'll be told that keto is crazy and it isn't healthy to cut out carbs. So imagine if you were telling them you wanted to do carnivore. You feel defeated before you even open your mouth. So the question you're going to ask yourself is, who am I to question this professional in front of me? I want you to understand that that's actually the patient trap. This isn't about conflict. It's about changing the balance in the relationship between the person that you're consulting about your health. And I want us to move from a passive patient to being an empowered partner. Please subscribe. So we have to think about why this happens. Why do we feel so disempowered, so less than in this situation? And we sometimes will blame the doctor. We think the doctor is somehow making us feel like this, but that's not reality, right? We walk in there ready for a fight, not realizing that the doctor isn't the villain. The doctor is a good person. They got into the profession because they want to help people. They genuinely want everyone's life to improve. The doctor is just like you and me. They're trapped in a broken system. The real villain, right, is this protocol that we are all forced into. We can wait up to an hour for a 10-minute appointment. And trust me, I've waited longer than the hour. And then there's this checklist on a computer that the doctor is going through. And I watch this happening in front of me and it doesn't make any sense, right? The standard of care that forces the doctor to see us as a list of symptoms, not a person, right? They're not talking specifically to Violet. Now, maybe if you've known your doctor for years, that might happen, that they're talking specifically to you, but often that is not the case. Often what we're having is this, you're a number, what's the problem? And that protocol actually depends on you and I being a passive patient. So what we need to do to change all of this is change the goal when we walk through the door. Because the goal is not to convert your doctor, right? And again, we walk in with this fight and we think we're supposed to change their mind about our diet. But that's not your job, right? To make them believe in keto. The goal is to get your doctor to collaborate with you. The goal is to break the protocol by requesting one simple thing, that they partner with you to monitor your health. All right, so since we're the ones that want the change, right? We need to show up to our appointment with some sort of plan. You need an agenda that proves you're a partner, right? You're not a patient, you're a partner. So I want to show you what that kind of agenda could look like. So you walk into this appointment with confidence. This is the plan that I use, first of all, and I hope it's going to help you. And it has 3 simple but very professional statements to it, right? They're kind of these overriding ideas that are going to help you and your doctor have a real conversation and change this forever. The first statement is you're talking about your action. And you're going to be very respectful in saying to your doctor that I'm taking responsibility for my health and I'm going to be removing all processed garbage, first and foremost. So processed junk food, all that stupidity. But I'm also going to be removing the grains and the sugars. And I want you to pay very close attention to what's happening here, Wellness Warrior, because you are not asking for permission. You're very respectfully stating what you are doing in your life. You're talking to your doctor, this professional who's walking with you to help you heal, hopefully, or keep you healthy if you don't have anything to heal, depending on what side of the coin you might be on at this moment. You're walking, you want to walk with them in this journey. So you're stating your actions. The second thing you're going to do is acknowledge their expertise, right? That's the next statement. I understand that this change can have powerful and rapid effects on my blood pressure, on my blood sugar, on any medications that I might be taking. You're basically showing your doctor that you're being responsible and you are aware of the risks. And of course, that's part of the reason that we need them, right? Now, I want to make sure that I'm clear about this because you're saying you understand that this is an outcome that's possible. They might clearly and quickly jump to the conclusion that the changes you make are going to worsen what's happening with your health, right? I'm going to talk more to that point, but don't let it knock you. Don't let it get you off course because remember, we walk into this story knowing that they might not have any knowledge of keto or carnivore. We walk into this story knowing that they think taking away a food group is dangerous, even though we're not taking away a food group if we're doing keto. The food group is still there. We're just eating less of it. But they are confused by your desire to eat more meat or to prioritize meat in either, depending on what diet you're doing. Now, the third collaboration statement that you're going the third change. So the statement you're going to make is a request for collaboration, right? Something like, my primary goal is to do this safely. And I need your partnership to monitor my markers so that we can adjust my medication as my health improves, if you're taking medication, or we can, see if my health is remaining the same or getting better. For example, does my weight go down? Or do my skin conditions improve even if you're not taking any medication for it? Whatever. Joint pain would have been the thing I would have been tracking in my case. Whatever is the thing that's frustrating you, that's bothering you, that you complain to the doctor about, we're going to monitor these things and see, do they improve? This is actually the key. You've just given them a new thing to focus on, right? Like they're rather than waiting and focusing on markers to go up because we all expect them to go up. They now have this new job of saying, well, are they staying the same? Are they going down? Or is this person's health improving? This job is no longer to manage your protocols, right? That's what they were doing. It's to monitor your success because that's what you are expecting of yourself. Now, let's go back to this case that if they object, what do you say? What do you do? Right? They might say something like, that's dangerous, a fad diet. They might try to convince you that you're going to ruin your health. Do not argue with them about whether or not what you might be wanting to try is going to damage your health because nobody knows what's going to happen. What we do know right now is the path you are currently on is damaging your health. What we do know right now is the path you are currently on, your weight is rising. In my case, my joints were aching. My skin was horrible. I didn't know it at the time, but my brain fog was increasing. I was tired. And so I didn't even know all the things that were going on that could have changed. But at that particular moment, what we do know for sure is your health is not where you want it to be, and you believe eating differently could help you. So don't get defensive. This isn't about what they believe or what they want for themselves. This is about what you want for yourself. And the most important thing that you can do to help this conversation go well is use the data pivot. And what that is you just tell them quickly and honestly that you understand their concerns. Because there is a lot of conflicting information about keto and carnivore, right? We can agree that the conflicts exist, but we can also agree to let the data lead the conversation. If you do keto or carnivore and So, for example, we would need to start first and foremost by checking your blood work and gathering it data. What do I weigh right now? Take some pictures. This is what my skin looks like, or, like I could log like, okay, right now my body pain feels like a X. Like, what is it? An 8 on 10? And maybe when I first came to see you, it was a 10 on 10. Now it's improved slightly with the medication, and it's 8 on 10. But what will happen next? And by the way, Wellness Warrior, if so in my case, saw the doctor, took some medication, and it went from being a 10 on 10, oh my gosh, I can barely do anything, to being an 8 on 10, I'm still barely able to do anything, but it's manageable, right? There's two parts to that story to remember. Even without medication, I would have gotten used to it somewhat, because you just get used to whatever you feel. But the medication got me to an 8. If 2 months from now I come back and all of a sudden I'm at a 3, yeah, that's not the medication. If I was taking the medication for more than 2 or 3 months, that's the change I made. So we need to walk into the story with the doctor with a baseline, because if we don't have a baseline, they will definitely try to convince us that the medication finally kicked in. Your medication theoretically should kick in somewhere between 4 to 6 weeks. So if you're already at the month 2 mark, yeah, what they will normally do is raise your medication. And honestly, that would be the point at which, no, well, whenever you decide to do it, isn't the point. They're going to raise your medication, and they're going to keep raising it, trying to get some kind of a result for you. So we ask them, let's run some blood work now. Let's take some measurements. Gather the data that we're going to, again, come back and verify in 60 days. And if my markers are going in the wrong direction, I'm willing to reconsider. What you've just done, Wellness Warrior, is you've taken control while still showing respect, and you've created a new standard for the relationship. I'm not upset with you about where my health is. I'm not asking you to give me a solution so that I can hold you accountable. I'm taking a bit of responsibility here too and saying, I understand food plays a role. Let me do my part and look at the food. You've become a partner. And I want you to see that this script is not really about your doctor. So that's not the reason that I want you to apply the script. Because it's not just about this one 10-minute conversation or the 10-minute conversations you'll have with the doctor in the future while you go over the data. This is about what happens to you after you walk out of the doctor's office. You just had this really difficult conversation, and you've done something hugely important, because this is about your identity. What you've done is, in that moment, you decided to be who you are, right? And that is the owner of your health. Their protocols only work because we feel powerless in those medical scenarios, right? Sitting there in a paper gown on a table, they leave you waiting for how long in the room by yourself, twiddling your thumbs, not dressed, the most vulnerable scenario we can ever be in, waiting for the all-knowing decision maker to come and tell us if we've escaped another year of disease or if we've finally fallen and need medication. Our job is to take care of ourselves, Wellness Warrior, right? Like, we were taken care of by our parents for years and years and years. Our parents were the ones that would fight for us in these medical appointments. I remember my parents fighting for me in medical appointments, right? And the doctors didn't believe that I was eating the red meat that they had told me I needed to get my iron in the right place because I was low iron. And my parents fought for me. They said, no, she's absolutely doing it. Like, you can't say she's not doing it. We watch her. She's doing it. And I mean, eventually the doctor did put me on medication. And again, they fought for me. Now she's taking the medication. Now, at the end of the day, the medication part, I did at some point stop taking the medication. So I will admit to that. But I stopped taking it because I was sick as hell on the medication. And only to find out later that that medication wasn't helping me. The protocols depend on us being passive. They depend on us continuing to eat garbage while we wait for that magical medication that's going to swoop in and do what? It's going to fix everything, right? What we end up doing by having this conversation is shut down the protocol by choosing to care for ourselves, right? We shut down that protocol by making the decision to eat real food. So this isn't the medicate. We're not waiting for medication to fix us, is what basically I'm trying to say, right? We are going to heal our body with healthy food, right? And our body wants to do that. Our body wants to feel amazing. It wants to heal. It wants, when you give it the food it's supposed to be getting, it heals. We are adults. We don't need permission to do what's right. You don't need permission. What you need is a partner to read the data that you don't know how to read, right? To help you stay on the road to health. Now, I know some of you might be new in this live stream, so I just want to say a little bit about that medication that I was taking, because I make these videos because I want you guys to get out of the stupid protocol prison stupidity that we're in. I was in that prison, right? The medication that I was taking, so the iron pills that I was taking didn't work. I was waiting for surgery for my hip because my hip was inflamed, and they told me, oh, arthritis, they told me all kinds of things. The medication didn't work because I have thalassemia. There was no medication they were ever going to give me that was going to make me look like I had normal iron levels, because I will never have normal iron levels. Yet I'm still sitting here in front of you, healthy and happy, because my iron levels are where they're supposed to be, given that I have thalassemia. I am not ever going to benefit from a doctor looking at a table of questions, insert answer for Violet, because you need to start your conversation with me knowing I have thalassemia. And if you don't know that, then you are going to make a mistake. Not one of those doctors ever asked me what I eat. Let's go to the next part, to the hip surgery thing. Not one of them ever asked me what I was eating. Never. But changing to a keto diet absolutely solved my hip issue. And it took 23 years for me to go from, oh, my joints are bothering me a bit. And I mean, joints, but my worst joint initially was my knee. My joints are bothering me a bit. It took 23 years from that, where I was doing sports therapies and all kinds of stuff to help my knee. And then it was, my back, and then it was my neck, and then it was my elbow, right? Yeah, 23 years till it was my hip and I couldn't walk. How long did it take me to heal with proper food? 3 months. My desire to avoid surgery led me to the keto diet, which got me results in 3 months. Would I say my hip was perfect? Not at all. But I went from can't pick my leg up to step up on a curb, and then when I put the pressure to step up, like tears. I'm not, I wish I was joking when I said tears. I'm not even tears, actual tears. Wellness warrior. I went from that to 3 months later. So I started in April, and in July, being asked by my spouse, hey, how's your hip? And not being, like, I had forgotten why I had started eating this way. I'd forgotten. My hip was fine. Now, I've looked back at some pictures more recently and realized that I see pictures of, I'm taking pictures of myself and the kids at the park where there's a lake. And to get down to the lake, and I'm down there, I would have had to climb down there. And I realized, wow, back in June, my hip had actually been feeling better. So that's now, we're talking April, May, June. We're talking 2-ish months. As a matter of fact, maybe 1.5, because April 20th, and it was before June 20th when I took the picture. It was the very first week of June. Can we just pause and see the crazy in that? that doctors were telling me that I was going to be having surgery to heal this and that I needed to wait for it to be bad enough. So I had to suffer a few more years, very likely. And you all know people who've had hip surgery, how many years they suffer with that, right? We all have people in our lives. And if you don't, I'll tell you, it's years. It's not a fast process before by the time that they say, okay, now you're ready for the surgery. Wellness warrior, all of my inflammation is gone. That we're not just talking about my hip, it's my back, it's everything. My hips, it's all gone. And not only did my inflammation go away somewhere between a month and a half and 3 months where I could say clearly, like, I feel amazing. And now we fast forward to today. It's rare that I get any kind of difficulty with this. This is the right hip, with this hip, right? If I do something super strenuous, sometimes I can still have a bit of problem, but just my normal, and I ride longboards. That doesn't cause me problems. Just pointing it out in case anybody's wondering. Like, riding my longboard is not something that causes me an issue. And that's me using this hip and joint and all of like this lower body so much. It doesn't cause me a problem. So I got my joints back. I lost the weight. It took 5 months for me to lose 80 pounds. So no surgery, no medication. I'm on nothing. And I'm here, able to share what I've learned with you, because I want you to get your health back too. Because I know that you can. I know that it's possible. But what you need is to be a partner in your own care. Being a partner is pivotal, right? Because as soon as I started to pay attention to what helped me to feel better, when I focus all of my attention on what helped me to, like, I pay attention to what, even in the foods that were healthy, keto foods that I was told to eat, I could see that every time that I have tomatoes or eggplant or, right? So these nightshade vegetables impacting me, I had to remove them. So pay attention to yourself. Don't just, it's just as about partnering with the doctor, but it's also in listening to yourself. Now, I know that there might be some of you that are still unsure about the healthy foods, because I mean, as I was doing all of this, I've understood there's certain healthy foods, There's certain healthy foods that aren't healthy, right? Like the tomatoes and the eggplant. And those healthy foods not only contribute to like pain, but then that's contributing to inflammation, which will then contribute to obesity in another way, or contribute to your health problems in another way, right? So we get the sugar down, but there's other things in it. So anyways, if you want to understand a bit better how to manage all of that, I really encourage you to watch the video that I did where I reviewed a video from Dr. Lustig. He was being interviewed, and I reviewed some of that information to help you guys understand what he was explaining about food, because there's so much to this. There's layers to this information. So that video with Dr. Lustig's information is linked in the description for you to watch.